All right. Good morning, everybody. Nikki Burnett here. Taste Life Nutrition Radio and podcast streaming live on KUHSdenver.com. And today we have on again, because it was such a fun time last time, Amy Beckley, who is the founder and inventor of Proov, which is a hormone test originally for getting pregnant, checking your hormones, understanding egg quality, right? And now for perimenopause and menopause and helping us understand that. So we're going to dig into that. And so thank you for being here again. So fun having you back.
Yeah, thanks for having me back. I must not have scared you off the first time.
We'll just keep trying.
Okay, cool.
So Amy's local. She's here out of the Denver area, and it's been really fun just getting to know her. And I love it when people bring things to the market that have never been brought to the market before. So we talked about your story a little bit the last time, but just for those who may be new, why don't we just give a little bit of your history, and then we'll just dig into the new panel, which is perimenopause, menopause, and we'll start to We'll start to dig into that. Okay.
Yeah. So I'm a scientist, and I've done vaccine development, cancer progression, and I got married and decided to try to have a family and realized how hard it actually was to conceive. Here I am, this smart, educated scientist, thinking, how hard could it possibly be to conceive? And we had a really tough time. I had 7 miscarriages in total. 3 years of infertility, 2 rounds of IVF, and throughout that entire process, I had a son, beautiful 14-year-old now, 2 rounds of IVF, but my daughter is 11, and she was literally a progesterone supplement that I could have gotten for a $10 copay using my regular insurance. And it was like, I went through hell and back 7 times and spent $40,000 when there was this much simpler solution that I just got misdiagnosed or not diagnosed, to be honest. And it's because we just didn't have the right tools to track our hormones and to really understand what was going on. And so I was basically overtreated. So I developed Proov to let women, couples, monitor hormones at home and understand what's going on with their body so that they could have a seat at the table, that they could be part of that journey. It's one of those most frustrating process to not understand anything, go into a doctor and not told, I don't know what's wrong with you. Here's this invasive $20,000 procedure that may or may not fix it. It's very unsettling. Yeah. And so just to have more information, to understand what's going on, to be able to ask better questions, is this the right treatment or something else that you could be doing? It's really to create a voice for women and help them understand their hormones a little more.
Knowledge is power, right?
Absolutely.
I mean, it's this amazing thing, and I'm going to tell you that over the last, half of this last year, I've done a ton of shows on hormones. So a little bit on men, mostly on women. So in all areas of life, because it's not something that we talk enough about. I think we talk we talk a lot about infertility, right? Because we can't figure out why everybody's infertile. And so that's a whole other topic. But the thing that has resonated so deeply with me and the patients and the clients that I'm working with now who are struggling with PMDD, severe PMS, infertility, or even just planning for pregnancy, whatever it is progesterone, right? I'm thinking about progesterone all the time. Besides the typical stuff, let's look at your diet, let's look at your lifestyle, let's look at your stress levels, let's look at your water, right? Let's look at all of these things. But progesterone comes up for me now all the time. And it's fascinating. I have a client right now, she's not trying to get pregnant, but she's starting to determine, holy smokes, these emotions that I'm feeling prior to getting my period are taking me down some really dark places. And it's, you know, it's scary for people, but thankfully she's realizing this. So we put her on some progesterone, and she's like, I'm sleeping like a baby. Things are, you know, it's very new, but it's these baby steps, right, toward trying to find that balance. And it's fascinating what just some progesterone can do, right?
Absolutely. I mean, that was my cure for having a baby.
Yeah. I mean, and it's pretty easy to access. And the cool thing too, you can't OD on it, right? We can get too much estrogen, we can get too much testosterone, but we can't OD necessarily. It doesn't mean we need tons and tons, but we can't OD on progesterone. And get this. So I went to a conference and was talking to a girl who does hormone replacement therapy, who had a female dog, who obviously was spayed, was in a lot of pain, things were going on, put her on progesterone and a little bit of testosterone, and her leakage stopped, her pain stopped, she turned into a young dog again. So I started putting my dogs on progesterone. I share my progesterone with my dogs. And I think that they are more playful, they are more interactive. I don't know this for sure, it might just be all in my mind, but I'm watching them get up and play, and you know, it's, you know, kind of the bright-eyed thing. They're healthy as it is, but it's just that, like, that little tick up, it seems like. Anyway, really cool.
Fascinating.
I know.
I mean, like, progesterone is like the miracle hormone. It's the happy hormone. It's something we just don't talk about enough. I mean, everybody thinks that estrogen is a female hormone. Fine, but I think progesterone also, you can't have estrogen without progesterone. Yeah. And so we need to be talking about progesterone more. And the difference between estrogen and progesterone is anybody can make estrogen. You can make estrogen in your fat cells, you can make it in your ovaries. Men have, you know, a certain amount of estrogen, and you can get estrogenic foods that mimic estrogen. And so there's a lot of like estrogen dominance in the world because there's so many ways to get estrogen or to pretend to mimic your body having estrogen by the foods you eat, the plastics in the environment, all that stuff. Yeah. But that causes your body to lose progesterone. If you're on birth control, if you're postmenopausal, if you're pre-puberty, you're not making any progesterone. Stressors in life, inflammatory foods, eating like crap, sicknesses, stress, weight, all these things affect progesterone, and not so much estrogen, but progesterone is the one that gets out of balance, and nobody really talks about it enough. I mean, before I came along, we couldn't test for progesterone at home, and nobody was talking about it. In fact, some doctors even believe that there's no such thing as a luteal phase defect. So here's your menstrual cycle. You have a menstrual cycle. Half of it is estrogen dominant. Your ovaries are making estrogen. Then you ovulate, you release an egg, and now you're progesterone dominant. And so you sort of half and half. They're like, well, you know, if you pop out an egg, then like you're just going to automatically produce the right amount of progesterone. So there's no such thing as like not having enough progesterone. You either have it or you don't. And there's like the word hormone imbalance is like not even a medical condition. It's like people just, oh, there's no such thing as estrogen dominance, there's no such thing as hormone imbalance, and you automatically have enough progesterone. And I'm like, why? Like, why are we saying that? It's because we don't know. It's like you can't say something unless you know what it is. We haven't been doing research. We haven't had the tools to measure progesterone levels adequately. We just haven't done that research. I mean, like, think about menopause. Well, you can't test for menopause. You go after age and symptoms. Baloney. You can totally test for that. You can test for hormones. Yeah. Like, and we go from a world where it's like, well, hormones fluctuate like crazy. And they absolutely do. You can't take a single blood test and understand your hormones. Right. And so we're saying, oh, you can't test hormones. You just can't do it. It's too complicated. It's like, well, you have to find a different way to do it. So you have to do it in saliva. You have to do it multiple blood tests. You got to go to the office every single day. You got to do it in urine, which is what we do. And so it's like you have to find a different way to measure things. You can't just say no. And so that's what happened to me. I was told, no, you can't, we don't know, whatever, do this. To come to find out, hey, there was a simpler solution that if somebody would have said yes to me and here's a tool, I could have saved so much pain and time and money and all kinds of stuff. So that's, progesterone is my soapbox. I'm like, pro progesterone.
Yeah. No, I love it. And I think it is important because we don't talk about it. And what you're saying, it reminds me of, when we say that there is no such thing as luteal defect or luteal phase defect, or we're just going to do what we're going to do kind of stuff. It goes back to this attitude that, like the appendix. Well, who needs an appendix? We don't know what it's for. Who needs tonsils? They're not really part of the immune system. I mean, they're there for a reason. And to sit there and say, well, we don't know what it is, so it doesn't matter, for one, is ignorant, and it's sad, and it doesn't make any sense. And it's really frustrating because the body is so beautifully created, and it can, I say this a lot. I feel I might have said it to you last time, I don't know, but the body's ultimate job is to keep us alive. And so when it gives its symptoms, it's saying, hey, I need you to jump in now. And so we don't understand, we don't have this, a lot of us don't see that something like, and this is not hormonal, I don't think anyway, but if we have a sniffle, right? If we have a stuffy nose, these things are symptoms of something. If we have joint pain, if we have headaches, if we have brain fog, if we have PMS, if we have PMDD, if we're not able to get pregnant, these are the things where the body's trying to talk to us, and we need to pay attention, learn to pay attention, find someone to help us learn our bodies to know how to pay attention. And kind of, sort of piggybacking on that, when we're talking about estrogen and how we can be so estrogen dominant, which is what then, pushes progesterone down, right? I think it's important that we hit on the fact, and you did to a degree, but I want to dig into it a little bit, is that the plastics, the environment, the pesticides and the herbicides that are in our food, the things that we're putting on our skin, that are chemicals, not our natural healthy stuff. And it can't just say natural, right? It has to actually, you got to look at the ingredients and know what's in it. But all of these things, what you're putting in what you're cleaning your clothes with, what you're cleaning your floors with, what's on your couches, the fire retardants, all of these things are significant endocrine disruptors on top of just being completely toxic and burdening the body and not allowing the body to detoxify properly, but it's impacting estrogen because they're estrogen mimickers, and so it doesn't allow our own natural estrogen to do its job. So we've got all of this stuff that's going around in the body. Our progesterone is in the tank, and we're like, why do I feel like a crazy woman? Whether you're in your period days or whether you're moving into perimenopause, symptoms are going to be worse if we're not in a balanced place, and having this inundation of chemical estrogens and then bring in the birth control pills on top of that. It just sets us up for just significant frustration because we don't feel good and we don't sleep, and then we get hot sweats, and that's kind of, I want to move into the perimenopause, because the fact that you're saying now, wait, hold up, we can test for menopause and perimenopause. I think it's an important thing to understand when we don't realize, often, I'm hearing this all the time now, that 10 years prior to menopause, we're entering perimenopause. So jump in on that.
Yeah. So menopause, is defined as your ovaries die. They just quit functioning. And
how sad is that?
I mean, it's the only organ in the body of men or women that we just don't care that dies. But see, so ovaries make estrogen, progesterone, and testosterone. And when they stop functioning, your body doesn't make those hormones anymore. Like, you might be able to make some estrogen and fat cells and adrenal glands and little testosterone and stuff like that, but the majority of your hormones are basically just out the window. Like they're just in the tank. And the reason we get symptoms from this is because every single cell on our body has receptors for these hormones. So they're not reproductive hormones. They're not just for conception. They are hormones that feed your hair, your nails, your brain, your eyeballs, your heart, your blood vessels, your bones. Like these things feed into the system. And when they're off balance, you have symptoms of anxiety, of depression. I can't remember where I put this or that or whatever thing. I can't sleep because I'm too hot, I'm too cold. Like I just wake up and I can't close my eyes again. It's because your body is like, oh shit, I had these things and now I don't have them anymore. And so, we need to understand that process. And it's not like yesterday my ovaries were working and today they're just not.
Right.
This 10-year process where your ovaries just kind of start to sputter and they make maybe a little bit of hormone here and not some there, and it's like this roller coaster that your body's like, whoa, wait a minute, now that's different, now that's different. And so there's two issues that we're trying to solve for. The first one is, are these things I'm feeling due to the perimenopause transition? It can start as early as 35. We have 38-year-olds coming in, oh my gosh, I'm just not myself, what's going on? And by the way, the first symptom that most women have, anxiety or depression, I just don't feel like myself again. Those are the first ones that typically, and that, my friend, is due to low progesterone. Because that is what is happening on your brain, is those changes, and it's causing your cognitive function to change and to be altered.
So let's just kind of expand on that for a second, because what we're finding, what we're seeing, and I'm seeing this in practice every day, is women coming in. Women coming in who are struggling, they're sick, they don't feel well, so they have other things going on, but the drugs that they're on is a list of drugs, and it's always the antidepressant and the anti-anxiety med.
You're treating the symptoms,
right?
But are you going to treat the symptoms of every single tissue in your body? That's what the list of things are.
Yeah.
So you can either treat the symptoms, or you can get to the root cause and kind of address I'm not going to say fix, address the root cause. And that's where we get treating the symptoms versus hormone therapy, hormone replacement, whatever you want to call it these days, where you basically give back estrogen and progesterone that your body doesn't make anymore.
Yeah, I mean, it's this. You know what I wonder? Sorry, I just sort of went off. When back, 100 years ago, 150 years ago, right? When women are going through this process normally, and I say normally and naturally, but before we have all the chemicals and that kind of thing, we didn't have progesterone replacement therapy or estrogen replacement therapy, but we also didn't have the chemicals that threw us all so out of whack. I'm just so curious, and I don't expect you to know the answer to this, and maybe you do, but how women managed it when we didn't have that kind of stuff. Do you know what I mean?
I exactly know what you mean, and that's because women didn't deal with it because their lifespan was 50, 60. Yeah. And so, menopause is a new medical condition that is just now, because we're living longer, and it's like, your ovaries is the first thing to die, and then, this is so morbid, but then everything else just starts dying. It's like the first thing where you've peaked, you've reached the top, and then you just start shriveling away and dying, and it's horrible to think about that, but that's what it is.
Yeah.
It's you can let that process happen, and you can treat the symptoms as they go. Oh, I got a headache, I'll just take Advil, whatever. And it'll pass eventually, because eventually what's going to happen to your body is they have the receptors for those hormones. They're not seeing the hormones, and so they get rid of the receptor and they live without it. And that's when you get rid of the symptoms. But then what also happens is you're at an increased risk for heart disease, osteoporosis, Alzheimer's, because your body has reprogrammed itself to live without those things that have nourished it and caused it to be healthy, optimally function for so long, that now you're to higher, it's like 100x fold increase in all these different things. And so we used to just deal with it and we would die earlier. Now, I don't know about you, but I want to live a long time. I want to see my kids have kids and watch them grow up and give them amazing presents and take them on trips and all the fun stuff.
Yeah.
And be there to actually do it with them, enjoy it. Like, go on the cruise with them, not just here's something. Like, I don't want to be sitting in a chair. I want to be high
Wasting
functioning.
away, yeah.
Remember things and, be there, right? And so you have to think about it as you want to have optimal function of your body. And so you can't just let your ovary go away and be okay with it.
Yeah. I think that what we have done as a medical system has created a lot of fear, which is kind of sad and typical these days, but it's created a lot of fear around hormone replacement therapy and taking estrogen, and I think that people just sort of put in progesterone in that as well, but it's this, if I take estrogen, then I have an increased risk of stroke or cardiovascular disease or cancer. And what we need to bear in mind, and I want to let you talk about this if you're comfortable with it, is there's a difference between the chemical pharmaceutical grade of these drugs, right? So these are drugs, they're synthetic, they're not real, and the body knows when they're not real, right? When they're synthetic. Versus the bioidentical that the body says, I got this, I know it is, and I know what I'm supposed to do with it.
Yeah. So synthetics and bioidenticals. So a bioidentical hormone you can't take orally very well because it passes through your digestive system and it gets broken apart and it doesn't function very well. And so pharmaceutical companies were like, well, we got to make a pill that you ingest. Let's just modify it so that it doesn't affect it. And so they modified it and they realized, oh, it does stop you from ovulating and it's a great birth control. This is an estrogen compound. Here we go. And it's great because you can just take it orally. You don't have to worry about it, And so if you think about, hormones, these hormones are nuclear receptors, which means they sit on the cell and they come and they signal, and then it sits there and it goes to the nucleus where it starts transcribing different genes and it causes an effect, a change. And so if you have a natural hormone, you get change number 1. It could be like 10 different things were activated. Whereas if you have this synthetic, it could maybe activate maybe 1 or 2 of those things. The other 8 never happened. And so you can't think of synthetics as bioidenticals as the same because they're not. Because if they were the same, it wouldn't be birth control. And so, the studies that, the Women's Health Initiative did way back when that said, hormone replacement's bad, those were synthetics. Those weren't even bioidentical. It wasn't even progesterone, it was progestin. And they would purify this from horse urine. Like, come on.
Yeah.
It's just, I feel like science, biology, health is hormones, so complex. It's so hard to understand. We're just not going to explain it to her, or we're going to sugarcoat it, or we're going to lie, or we're going to just tell her part of the truth because we don't believe or trust or want to take the time to educate her fully. And that's what's happening. That's why it's so important as women. This is my only body. This is the person I have to live with my entire life. I know myself the best. I get 10 minutes with a doctor who, has an MD, a medical degree. That's amazing. Let's take me and tap into his degree to figure out how we can do this, or whoever health professional you go to.
Yeah.
But you've got to know about yourself. You've got to know some science, all that stuff. I mean, my 11-year-old doesn't know. I have to teach her about puberty and menstrual cycles and what it all means because her school doesn't do it.
Yeah.
They teach them about, vaping is bad, but they don't tell them what the hormones do. I'm like, well, too little both.
You're right. It's that the hard part about all of this too, and I'm seeing this now, and I think you know this, I don't know, but I've been doing some work with an immunology clinic. So immuno wellness. And it's I've worked in the medical world a long time, right? I've worked with doctors. I was in pharma. I was in surgical devices. I've done those things, and so I see what it's about. Plus, going to the doctor myself, which hasn't happened in a really long time. But what I see now is patients who come in, who are a part of this clinic, and to no fault of the clinic's own, they have, just like you said, 10 minutes. They are struggling. These are some of the most complicated people I've dealt with ever. I've dealt with some pretty complicated, complex issues, and this is like layer after layer after layer after layer after layer, right? And so what they get is great information for that time that they're there. But what about after that part? What about all the questions that they have? What about the lab results that they have? What about other things that they might need, other questions that they have, other symptoms that are popping up, all of these things that come up, and they're like, I don't have anybody to talk to about this stuff because I don't have the time because insurance is a racket, right? And so
that's like a whole other podcast.
Yeah, I know. So it's so frustrating. I have a lot of hope for what's coming up, and I've said this a couple of times, and not everybody agrees with me, and that's okay. I don't really understand it, but we have this situation where we have people who are being put into place who have the ability to change what insurance is doing, right, and what big pharma is doing. And some of these things are okay, and some of these things just are not okay. And so moving this into a direction that is patient-focused and not government, pharma, big ag, big food, big any of that focused is where we need to be. That's how it's supposed to be. We need to focus on the patient. So with all that being said, I mean, that's where I come in because that's what I do is I get to take the time and spend the time, but I'm not covered by insurance, right? And so that's it's sort of a little bit of a double-edged sword, but at least I can sit there and talk through these things with people and say, I wonder, instead of your antidepressant and your anxiety meds, if we were to take this little thing, give you a little bit of progesterone, what symptoms that might help us to start to unravel, and then we can start to address some of these other things as well,
Yeah. And I mean, it's not that doctors are bad. It's not that healthcare is bad. It's just the system is intrinsically flawed that you get this much time to know this much information.
Yeah.
And so you can't possibly get all the information you need in that 10-minute window that you're allowed to have. Mm-hmm. And so you've got to educate yourself. I mean, it's like everything else you do in life, you got to educate yourself. You don't just get in a car and go. Like you're like, all right, okay. I don't want to get hit. What do I need to know?
Yeah.
Not get in an accident.
Yeah. Well, and that's the hard part too, though, because if you're coming into this as someone who doesn't already know some stuff, how do you know where to go to get the information, right? You go to, the internet. What are you going to get from the internet? A million different answers.
Yeah, this is where I think I got stuck at first. Mm-hmm. Was I came back after I had 2 rounds of IVF, and so during the process of IVF, they take the sperm, they take the egg, they fertilize it in a dish, they put it back together, and they pump you full of estrogen and progesterone to help with implantation. So they basically your body's not going to do it. I'm just going to give you exactly what you need in this dish. It's like a medical Band-Aid. Mm-hmm. And so afterwards, I'm like, why did that work? And I couldn't ever hold a pregnancy. And I got stuck in this idea of progesterone because what it does is it allows the uterine lining to be receptive to the embryo and support that growth the entire 9 months. And so I said, maybe I'm just not making enough progesterone. And they're like, well, we don't really know if in a natural cycle that's going to help because we've only studied it in IVF. And you think about that, it's because these pharma companies are making IVF medications to make IVF work. Mm-hmm. And so they have progesterone that's used in the IVF that works really well. It's in I think 100% of IVF procedures, you are given progesterone because it is shown to increase success rates 50%. And so they're like, progesterone's a miracle, increases pregnancy rates 50%. Let's give it to everybody. And I'm like, cool. Can I not do the IVF part and just take the progesterone? They're like, we don't know if that works.
Let me show you.
I'm like, can I just try it? They're like, yeah, sure. It's not going to hurt anything. Like you said, you can't OD on progesterone. It's like not going to hurt anything. 2 cycles in, pregnant naturally. She's 11. She's the one that's about to have her period. You know, all that fun stuff. So it's like, yes, it works, but we don't have the research because everyone's like, Amy, this is an amazing idea to test progesterone at home. Why hasn't anyone invented this yet? I'm like, well, because we're pushing IVF. All the money is in IVF. All the pharma companies, all these doctors are getting trained. Like, healthcare is an expensive thing. And so when you're prescribing a generic medication that takes one visit, it's not very much money in that. I'm not trying to say like it's corrupt or anything, but like it's a business. Healthcare is a business. It is a business like everything else. And so you just have to think about it that way. It's a business. You keeping yourself healthy is your business. You've got to think about your bottom line before you think, you know what I mean? Like everything.
Yeah. So you took, I know I asked you this last time, but I want to make sure that I remember correctly. You took progesterone throughout your pregnancy, correct?
I stopped at probably 18 weeks.
Okay. So could somebody take it throughout pregnancy?
Absolutely.
Yeah.
Yep. So at any point you drop progesterone, it's either you couldn't get pregnant, you had a miscarriage, or then you go into preterm birth. And so you can take it at any point, throughout the entire time. Most of the time, so your ovary is this little ovary that makes progesterone till 7, 8, 9 weeks, we don't really know, of pregnancy, and then your placenta takes over the production of progesterone. And so a lot of times it's the ovary that just can't make the progesterone, but then as soon as the placenta's made, it will take over that because it's a new organ that you just made.
So cool.
And it's fresh and new and beautiful and it's functioning great.
Yeah.
There are cases where placentas don't make enough progesterone. And so, most of the time the issue's in the ovary, and as soon as the ovary takes over, you can just stop progesterone. I was so nervous. They're like, 10 weeks you can stop. And I was like, I'm just going to keep taking it just for my own mental sanity. I do not want to have another miscarriage.
Yeah.
But women that are nervous, I'm like, go in, get a blood draw, check your levels and wean off of it and just make sure your body's retaining enough of it. And if not, just stay on it.
Would you, as you're coming to, and I know we're supposed to be talking about perimenopause, but I can't help but to ask the questions. If you were, so say you're coming up to, you're delivering within the next 2 weeks, would you stop, and could it push delivery? Do you know? Or labor, I guess?
So I do not think that progesterone is the trigger for birth.
Yeah.
I don't think taking it will prevent anything from happening. I think it's like the oxytocin, it's those other signals. And it's interesting that you say that is because your body, your placenta, so you give birth and then you give birth to the placenta. So you still have the placenta that's pumping out hormones after you gave birth. It takes, 30 minutes, an hour for it to like come off the uterine lining, and then you can, pass it as well. But that organ that just came out, that made estrogen and progesterone, now you just crash. You are not making anything, and your hormones go from like tippy top to like nothing. And so I actually like women taking progesterone after they give birth to help with that postpartum depression.
Yeah.
Because that huge drop in hormones, like again, like you're like they call, it's like, oh, your pregnancy, you're glowing. It's like your skin is so good, your like your nails, your hair, like everything is just amazing, right? And then you give birth and you're like, freaking hair's falling out with clumps and like your nails are breaking off and you're like, what is wrong? Like, it's because your body is just doesn't have as much hormone anymore.
Yeah.
And so giving hormone, can help with those symptoms. I don't believe you should take estrogen as well, because I think that does pass through the breast milk and can affect the baby. And so a lot of times they'll give like progesterone only birth control for women who are nursing. But progesterone, totally fine. Again, you can't OD on progesterone.
So is this, I mean, there's I don't know if it's a trend or a thing or something that's, super traditional, right? With putting the placenta in a pill and eating it or taking it, right? And so it's just for that reason, it's for the hormones or other things?
I don't think it's the hormones. No? I think it's the nutrients. I think it's just a very nutrient dense organ. I never really got into that. It was a little bit past my time. My kids are 14 and 11, so I think it's a newer trend now. So I haven't really looked at the research so much, but I know that there's companies coming out with like colostrum vitamins and stuff, because it's just such a nutrient rich, like it's got like stem cells and like cytokines, all this fun stuff that's supposed to be like new birth and like just newness, and we haven't ruined anything yet.
I put people on colostrum all the time.
Yeah.
All the time. It's super gut supportive. It's going to build it's immunoglobulins, right? It's going to build your immune system all the time. Yeah, it's good stuff. So let's do this. Let's maybe talk about perimenopause and your test. And so I guess what do you, so people come to you and they're like, I'm feeling like shit. I'm depressed and I have anxiety and this has never happened to me before. And so you say, guess what I have now? Because it's brand new, right? Within the last few months, yeah? And so talk to me about what this is testing and what women can expect from it.
Yeah, so when women come and they're like, I just have these symptoms and I just don't know what's going on, we help them with two things. So the first one is, are your symptoms due to perimenopause or is it something else? We don't know. And the second one is, how do you actually manage and get rid of those symptoms? And so that's the key part of this, that it's not just like, oh, yep, it's perimenopause, very cool, see you later. It's like, well, that didn't fix anything, it didn't help. And so how the test works is, it's a urine-based test, and it comes with an app, and you download the app and you put in your age, your symptoms, if you're on any medications, supplements, how long your cycles, are they normal, are they regular, are they not, all that stuff. And then we build the protocol for you, and we want to scan your hormones over a 4-week period. And when I say hormones, I mean FSH, LH, estrogen, and progesterone via the urine metabolites. So we can see how they're doing this, or are they doing this, or is it just this, or is it, we just want to see how they're changing, because it's fluctuating hormones and the relationship of the hormones to each other that cause your symptoms. And so what we do is we say, okay, your symptoms are X and your hormones are Y. Now we know how to truly understand what's going on and bring you to the right solutions. And so solutions for us are, we have herbal medications, or herbal supplements, supplements that help your ovary work better. It helps your body make these hormones better. Then there's a certain point where, hey, what, your ovaries, they're just not working anymore. We cannot support helping you make those hormones. If you want those hormones because you don't have them, let's talk about hormone replacement. And we talk about HRT, things like that. And so we really try to educate women, what are your hormones? Why are they causing these symptoms? And that education, and maybe hormones are right for you, maybe they're not. Are there other solutions? But we do find a lot of women are scared of hormones. Yeah. It's scared because they don't have the education. They don't know.
Right. Well, it goes back to, I think there's been a fear instilled in us, and we don't know, there's not the understanding of the difference between chemical or pharmaceutical and bioidentical. And I see that a lot. I always hate to say that make it a general statement that there's a lack of understanding, because I don't want to assume this, but I see it in practice all the time. When somebody comes to me and says they're on hormones, I ask them, are they bioidentical? And they're like, I don't know, what do you mean? Or, I don't know, my doctor just gave them to me, right? And so I don't want to assume that nobody knows, but I do see it regularly, that there's it's this trust factor. It's, okay, the doctor gave it to me and it's fine. And that's great a lot of the time, but you still need to be your own advocate and know the questions.
Know, because doctors don't, either they don't know or they don't want to take the time to explain it.
Yeah.
I was just talking to somebody last night, and she said, yeah, my doctor put me on the estrogen patch. And I'm like, well, you need to take progesterone with it. She's like, oh, I'm on the Mirena, so I already have progesterone.
Oh.
I was like, okay, so it came from the doctor, because the doctor gave you the estrogen patch, and so they assumed you had progesterone. So Mirena has a progestin in it that prevents ovulation. That's why it's a IUD, birth control. And so they're just calling it a progesterone, and they think that it acts the same way.
Yeah. Yeah, that's heartbreaking. Yeah, this is one of the things, going, just the Mirena itself, and not having periods. It goes back to, again, do we need to have an appendix? Do we need to have our tonsils? Do we need to have a period? There's a reason we have our period. Yeah, it can be kind of a pain, but there's a reason for it. It's cleansing, it's cleaning, it's intentional, and it's necessary. Please stop cussing your period and just have it.
So a period can be a lovely, perfectly fine experience, but if you're having a painful, a heavy, annoying period, there's something hormonally wrong with you that you need to fix.
Yeah.
So you kind of have to say, like, what kind of period? So, like, people that have normal periods, they're like, okay, it's kind of annoying, but, like, if you're like, I cannot leave the house, it hurts so bad every time I move, I feel like I'm just gonna, like, gush out. There's something wrong hormonally or structurally or something that you need to get fixed.
Yeah.
Because periods shouldn't be painful or hurt. I've been trying to ingrain this in my 11-year-old. She is scared to death of getting her period.
Aww.
And I'm like, it should not be painful. And if it is, we will figure it out.
Yeah. And that's the thing. I mean, I've had clients who, would have to, be admitted to the ED, the emergency department, because they're in so much pain or they're passing out. I had one in particular who was having just this issue, so her doctor put her on another hormone, so then she was suicidal. Yeah. And so I think more than anything, what I hope that people can get out of all of these conversations around hormones is paying attention and having the awareness that, number one, anxiety is not normal. So figure out why, right? Ask the questions. It's not about taking an anti-anxiety med. Depression is not normal. Figure out why. It's not about taking antidepressants. Thoughts of suicide are not normal, right? There's something that's pushing that, right? Yes, life can be heavy and hard, and there are lots of things. But what if there is a hormonal dysfunction? There are these things that are happening that we don't know is not us, right? I mean, it's us, but it's not. Does that make sense? I don't know how to explain it any other way. But it's
what you typically get is like, I just don't feel like myself anymore.
Yeah. Yeah, and that would be another symptom, right?
Yeah.
And then the onset of the weight gain, and I would go back to something that I've heard a number of times is women get to this point, they have jobs, they have businesses, they are fully ingrained in life and society, and then their mind starts to go. And when I say that, right, their memory is not working. They're not as sharp as they used to be. They're forgetting things. And so there's then, oh my goodness, do I have Alzheimer's? Do I have dementia? What's happening? What's going on? When really, a lot of times, it is this lack of hormone, this lack of communication with the brain, which is supportive of brain function. right?
Yeah.
And so people are leaving their jobs because they can't, their brains don't function anymore. It's so sad.
Yeah, think about this. You start working when you're 20, 21, whatever, and you've been working 20 years, you're in your 40s, you're getting promoted, you're like at the top now, and you're like taking charge, and you've done all the crap, and you've worked your way up, and then now you feel like shit, and you can't function in your job. Like, holy crap, that's life-changing.
Yeah.
I was talking to one of the head people at one of the biggest corporations in the U.S., and it was a woman, and she was in her, at the time, 60s, and I was talking to her about hormones, and she was like, Amy, I believe every word that you say, because I just started feeling like shit, and I was like trying to run this company, and one of my doctors is like, here's some hormones, and it was life-changing, and I will never stop doing it. And so she had been on hormones for 10 years. And she's like, you have to pry it out of my hands before, because it's like, it was life-changing, it was transformational for her, because she couldn't function, and she had this high-performing job that expected her to perform. And so, I mean, I've heard that time and time again. It's like, oh my God, it's life-changing.
Yeah. Yeah, and this is why we have to talk about this stuff more, because of the lack of awareness around what hormones do and how they impact brain function and cognitive abilities and our place in life, right? I mean, it can impact who we are, where we are, what we are, and just change everything for the bad if we don't have them and for the good if we do. And so, but we can't take away the importance of a healthy diet, staying away from the xenoestrogens and the plastics and the toxins, and, bringing in, making sure you're getting good sleep. If you're not sleeping, is it hormonal, right? And there are lots of things that can create that. But there's a cool trick, and I haven't done it yet, but I've heard really cool things about it, is inclining your bed, the head of your bed, not like a sleep number, but like the bottom of the bed 5 degrees, and that can change sleep. It can get rid of cellulite. It's all this cool stuff. I'm like, I need to do this, and I haven't done it yet. But
so wait, so if I have a bed, and here's the head of the bed, I put like a 5-inch block underneath the 2 legs at the top.
Yeah, exactly.
That's it.
Yeah.
Huh.
Yeah.
All right.
So
what does it do for men though? Because there is a man that sleeps in my bed with me.
Snoring?
No.
So I think it's a part of it is about the lymphatic system and blood flow. So right. So say you have even something as significant as lymphedema or something like that, right? And so if you are just a little bit elevated, it prevents. Or I deal a lot with the EDS, the Ehlers-Danlos syndrome, right? But it can, those kind of connective tissue issues, because they can be also vascular. Blood can kind of sit and pool like POOL, and it's totally off topic. Sorry, but I can't help it. I think it's cool. But it keeps it keeps things flowing, right, and kind of going down, and so it can be beneficial for. For anyone, but especially those who have, any kind of inflammatory issue, it might be helpful. Anyway, I haven't done it yet. I keep threatening to do it. I think every time I go to bed, I'm like, damn it, I haven't got my blocks yet. But he said,
I'm just trying to see if my husband would realize that the bed was changed.
Yeah, that's a good point too. So I don't think mine would. He actually always wants his head up anyway, so whatever. But if it helps with, can help with snoring, then I'm all about that one. Anyway, back to perimenopause. So talk about your app. What is your app showing?
So the app shows your hormone levels, your symptoms. It shows what stage of menopause you're in. It gives you personalized solutions based off of your hormone profile, your symptoms. And so it's all about, educating and telling you where you're at, helping you through it, managing your symptoms, giving you resources. Like I said, like menopause is not like one day your ovaries worked and then the next day they didn't. It's this gradual decline, and then along that decline, you have different hormone profiles that need to be treated differently. And so if you're, say, 40 to 50, so 51 is like the average age of menopause. We'll just call 51 as menopause. You start to get these hormone fluctuations late 30s, early 40s. You have like 10 years to get to this level. This level is like no estrogen, no progesterone. You need what we call HRT or hormone therapy, or whatever you want to call it these days, in the typical sense. So this line here between 40 and 50, you may not need this. You may not need as much estrogen because you're still making estrogen. You might only need progesterone. You might need vaginal estrogen and not systemic estrogen. You know, so there's like this trajectory where if you want to feel the best, you need to test your hormones and look at symptoms and find that personalized thing for you, because hormones are hormones and women are women, and not all hormones affect all women the same way. It's just why there's like 50,000 different types of birth control, is because hormones, they're different. And so you can have two women given the same regimen of hormones. One can feel fantastically fabulous, the other one will be like, it made me feel worse.
Yeah.
And it's because the way we react to the hormones, what else we have going on, what our environment, our diet, genetics, all that stuff. So you really need to take your symptoms and your hormone levels and like find what's right for you and your body. And it can change along that pathway. And so it's just an easier way to get the right answer the first time, and not just like, all right, I'll try this. Okay, I still feel like crap. Okay, we'll try this next month. I still feel like crap.
Yeah. So I know for, you know, when you're testing your ovaries, your eggs, your hormones for pregnancy, your goal, what I believe you find ideal is testing several months at a time, right?
Yeah, so if you have like a hormone imbalance, ovarian function that's not ideal, it's testing over a few months and making changes to show like that it's working well. But if you have a healthy ovarian function, you just need to test to find your fertile window. You do what you do with the fertile window. And
yeah, cool. So with the perimenopause test, so is 1 month of testing enough, do you think, or is it kind of the same thing where you sort of can tweak as you go?
Yeah, I mean, it depends on where you're at. If you are just full of symptoms and you're in your early 40s and really trying to figure it out, like we say, like a couple months is probably good, and start making some changes. But if you're like at the bottom, you know, 1 test is enough, and get on HRT. It depends. It's dependent on your symptoms and where you're at.
Yeah.
But the app will basically tell you, like, we think it's a good idea that you should retest in next month or next 3 months or whatever, or you know what, you're good. You don't have to test anymore. Because I mean, the goal is to help them feel better. It's not to make you test for things that you don't need to test for.
Yeah, and the pricing is really reasonable.
Yeah, so it's $69 for the kit, and it measures progesterone 4 times, estrogen 4 times, FSH 3 times over the 4-week period, and it generates a really big report. So you can think of it as like if you go to LabQuest and you get 1 blood draw, I'm pretty sure you're over $69.
Yeah, for sure. Yeah, that's great, because then you can, I mean, it just makes it feasible, easier, doable, all of the things to test and retest and understand your body, because that's the ultimate goal.
I have a lab request in my inbox right now, and I'm like, when am I going to get across town to go to the stupid lab thing and get my blood drawn?
Yep.
It's so much easier. You wake up, you take the pee, you dip the strip, you wait 10 minutes, pink, okay, done.
Done, yeah. That's the great thing about testing these days, too, is all of the home kits. So whether it's urine, blood, I do finger prick tests all the time. You send them home, and you take your blood, you take your own blood, right? It's so simple. Stool, hair, urine, all of it. It's just like, it's so cool where we're moving with testing to make it more simple, to make it manageable to do this kind of testing, and especially with something like yours that is so financially doable, right? I mean, that's $69 is nothing. Yeah, for all the information that you get.
Yeah, and then think about like how much money you spend on supplements every month that you may not be needing or might be making it worse, or the lot of supplements we see we call like the paper bag, where it's just like they just throw everything in it. I think the technical term is fairy dusting, where it's like, oh, this changes hormones, cool, we'll put that in there. Oh, this one affects hormones, we'll put that one there. And then you have things that are like, this one increases estrogen, this one decreases estrogen, this one increases progesterone, and they're all in the same pill you take. And your body's like, wait a minute. And sometimes they'll work for a month or so, and then they'll just stop working, or they'll make things worse. And so we divide those herbs and those ingredients into the components. Like there's a set that increases estrogen, there's a set that helps you metabolize and decrease estrogen, there's a set that helps you make progesterone, and we fragment them out.
Yeah.
And if you need one of them, here you go. If you need two of them, here you go. You never need all three.
Yeah. That's amazing. Do you have, and there's not really this capability, I don't think, on any testing, but if somebody comes back to you and they have elevated estrogen, as many people do, is there the ability to see if it is natural estrogen or xenoestrogens?
No. So there's different types of estrogens. There's estrone, estradiol, and estradiol. So E1, 2, and 3. They are fat soluble, and so they don't get passed in urine. They have to be conjugated before they're released, and so they're metabolized and conjugated to something that lets them be passed in the aqueous urine. And that can be done many different ways. So like Dutch test, that manufacturer talks a lot about the different types of urine metabolism, and like you can go down one pathway and that's actually more cancerogenic type of metabolism versus another pathway. There's different enzymes that metabolize things. So it's a very, very complicated thing, is what I'm trying to say. We measure the main urine metabolite of E2 estradiol, which is the main type of estrogen. So it's called E1G estrone gluconide, but it's the main metabolite of E2 estradiol. But there are other conjugates that are produced. I don't know enough about estrogen metabolism, to be honest, to know about like the xenoestrogens or whatever. I do know that women will get their blood E2 tested, and they'll look at their metabolites, and sometimes like the metabolites are really high and the blood is really low, and we don't really fully understand why. It could be because it's being produced in the tissues and coming through and metabolized. It could be these xenoestrogens that we're seeing that's not in the blood. We don't know exactly, but hopefully one day we'll know more.
Yeah, well, and you do urine, and that's what I've done in the past when I'm looking. I've used Dutch, I've used Vibrant, and then yours, and in my understanding, it's as accurate as anything else for these purposes, right? And so.
Well, yeah, I mean, like, urine is accurate, blood is accurate. It's what are you trying to measure?
Yeah. And
so blood is accurate for that moment you took the blood out of your body and put it on that little card or in the tube or whatever. It is 100% highly accurate to that 1 minute, second in time. The problem with the blood is that it's whatever your ovary is doing, so it produces hormones and pulses, and so they're going up and down constantly. And so it's true that your blood was X at that particular moment in time, but was it Y 2 minutes earlier or Z five hours later? Like, we don't know. And so the benefit of urine is that you're basically taking these peaks and valleys from blood and you're saying, what's the average of that? Because this is what I'm secreting every day. And so use first morning urine to see what is that level.
Yeah.
And we can build patterns over time of your average levels across and see things. And so it depends on like, you know, like I got misdiagnosed for a progesterone deficiency because I had a single point in time blood test that said I had progesterone.
Fascinating.
Well, 2 days later it dropped and I would lose my pregnancy. And so it wasn't being measured at the right time.
Okay, yeah.
So, you know, like they're both accurate, they're just measuring different things.
Right.
And I think if we're measuring hormones that fluctuate constantly, we can't rely on a single point in time to tell us anything of value.
Yeah.
You do it multiple times, or you have to do something else.
Yeah. Well, yeah, and that's amazing because, you know, we know that they're fluctuating throughout the month, but to have that understanding that they're fluctuating minute by minute, it's amazing and makes it that much more complicated, shockingly, right? Everything is so complicated, but that's why we're so beautiful and unique. But yeah, I think that makes so much sense, and I've never explained it that way, so that's helpful for me. Thank you. Awesome. Well, tell people how they can find you and get your tests.
Yes, the website's proovtest.com, so Proov test.com. We're also on Amazon. Who doesn't like Prime delivery? And our fertility tests are in Walgreens and CVS, not the menopause yet. We're on social media, Instagram, TikTok, Facebook, all that fun stuff. The handle's usually like @ProovTest. But yeah, and then if you go to our website, sign up for the newsletter, you can get discounts, and then we have free ebooks, either for the menopause or the fertility side, that I call like fertility or menopause for dummies. It's just like 8 very simple graphical pages that try to break it down so that you can dig into stuff later.
Yeah.
But a very high level summary of the information.
Cool.
Those are free.
When did you start this company?
2016.
2016. And you have been blowing doors since, right? Like I'm assuming you're growing like mad.
Yeah, we are. Yeah.
Good. That's awesome. And that's a great thing too. You know, a lot of testing has to be done through a practitioner. This is the type of testing that should not have to be done through a practitioner, right? You need to, you know, again, it's back to advocating for yourself and having control of your own body and knowing everything that you can know about your body. I think it's so good. I love it. Thank you.
Yeah. We try to make it as simple as possible in a process that's not simple, to make it understandable and digestible.
Yeah.
I think Dutch is great. It's a very high complexity thing that a lot of people don't understand how to interpret, and so we want to be that first step, that like, all right, this is your initial education. You know, you can branch off to something more complicated and advanced like Dutch.
Yeah, my first Dutch test was like, I can figure this out. I looked at it and went, okay, here we go. It's time for some education. But you're right. It's complicated, but still, it's all fascinating because it gives us all great information. So, thank you. Let me ask you this. Here's a question for you. We're up against time, but I'm curious if you would have any plans, or if it would be of benefit to you or anyone to have a test that would be like for PCOS.
So, interestingly enough, our complete test for our fertility audience, it scans the entire cycle. So most fertility tests are just focused on the fertile window, like, when do you have intercourse, when does it open, when does it close? We look at the entire cycle. So we look at your baseline hormones, your ovarian reserve, your fertile window, the estrogen levels as opposed to progesterone levels, your luteal phase health, all that stuff. We do this deep analysis of the cycle and give you a report at the end. We've done that so many times for so many women that we have like 2.5 million data points in our database, and we're now starting to find patterns in the data, and we're typing them. Okay. And so we can identify a PCOS cycle now without somebody telling us that they have PCOS by certain hormone patterns.
Interesting.
And so one of my to-do list things, bucket list, is to create a test like that for PCOS, because women have to wait like 10 years to get this diagnosis. And you know, it's not just like diagnosing PCOS, but it's living with PCOS, it's managing PCOS. And so we can look at the signatures of a woman who is either like well managed PCOS, or hey, you got PCOS, here's things you can do with it. I think that'd be huge. There's more research we have to do.
Yeah.
For that.
Yeah. That's fascinating. You know, at this point, it's really looking at, you know, glucose and testosterone, right? And so y'all don't test testosterone, correct?
No.
But you can look at other markers or other patterns and see it. That's so cool.
Yeah, so the reason they look at glucose and testosterone is because the ovaries are not functioning in PCOS. So basically, you try to function, and then there's resistant to it, like just like you would have insulin resistance in your tissues, the insulin resistance in your ovaries. They create estrogen, but they don't ever ovulate and make progesterone. So they get these hormone imbalances. And so that causes a dysregulation between the brain and the ovaries. And so you can see different patterns in the data, because LH and FSH are brain hormones. Estrogen and progesterone are ovary hormones. And so if you look at the interplay between the two as they're trying to communicate, you can pick out patterns across the data that's like, that's a dysregulated system. That's PCOS.
How fun.
I know, right?
Yeah, that's really cool. I'm excited. I'm excited for that one to come out. That's just super cool what we can do, what we have access to. So keep going, keep kicking ass. I love it. Good stuff.
Will do.
Okay. Very good. You said everything you need to, right? Where you can be found? You've ever?
Yep.
Okay, good. Go find her, because it's good stuff. Go get the test. Go to Amazon. Go to their website. Get all of the things, the apps. This is exciting stuff. So, all right, you can find us here every Thursday, 10 a.m. Mountain Time, streaming live on KUHSdenver.com. You can find me, Taste Life Nutrition, in all the places, all of the socials, all of the website, all of the things. So you can fill out an assessment on my website, and that will come straight to me. We'll chat a little bit about what's going on with you, and if I'm able to help, then that's awesome. And if not, then I refer you to some of the amazing people who I know who can help you. So feel free to reach out. We'll be here again next week, 10 a.m., and we'll see you then. Bye, everybody. All right, girlie. Thank you so much.